Do you get up at night to pee more often than before? Or notice changes in your sexual health? These could be more than just normal signs of aging. After 40, your prostate quietly becomes one of the most important organs to watch. Ignoring early red flags can put your health and even your life at risk. The prostate gland is a very important part of men's urinary and reproductive systems, even though it is often left out of everyday health discussions. It goes around the urethra in a way that is similar to how a donut goes around a straw. It is located directly below the bladder and in front of the rectum. Changes in hormone levels, especially testosterone and dihydrotestosterone, DHT, are the main reasons why men's prostates get bigger as they get older. This is a normal biological process, but it can have a lot of different effects, some of which are safe and some of which could be deadly. Men over 40 need to pay close attention to changes in their urine patterns, sexual health, and pelvic comfort. Early warning signs are often small and slow to show up, but if you ignore them, diseases like benign prostatic hyperplasia, BPH, prostatitis, or prostate cancer can grow without you knowing. This article will talk about 5 signs that need to be looked at right away. 1. Going to the bathroom a lot, especially at night. Nocturia. Nocturia is when you wake up at night to pee. It is one of the most common early signs of prostate problems. If you only have to get up to pee at night once in a while, it could just be because you drank too much before bed. But if you have to get up more than once a night, it could be a sign of changes in your bladder or prostate health. When the prostate gets bigger, it puts pressure on the urethra, which makes it harder for the bladder to empty all the way. Even a little bit of leftover urine can make you feel like you need to pee more often. The muscles in the bladder may also become too active and contract before they are full. Nocturia can be so bad for some men that it breaks up their sleep, making them tired, irritable, unable to concentrate, and even putting stress on their hearts in the long term. Nocturia can be a sign of prostate inflammation, bladder problems, kidney disease, or even metabolic conditions like diabetes. But benign prostatic hyperplasia is the most common cause. Men sometimes deal with this by drinking less at night, but this only helps for a short time and doesn't fix the real problem. If you have persistent nocturia, it means that your urinary system is under stress. The only way to know for sure if the prostate is to blame or if something else is going on is to see a doctor. 2. Pain or burning while urination or ejaculate. People who feel a burning or stinging sensation while urinating or sharp pain during ejaculation should not ignore these symptoms. In men over 40, these symptoms are most commonly linked to prostatitis, which can be either bacterial or non-bacterial in nature. Acute bacterial prostatitis typically manifests abruptly, frequently accompanied by fever, chills, and myalgia, and is regarded as a medical emergency necessitating antibiotic treatment. Chronic prostatitis, on the other hand, can develop slowly, with episodes of mild to moderate pain that come and go for weeks or months. Prostatitis causes inflammation, which can make the urethra and surrounding tissues swell. This puts more pressure on them. This not only hurts, but it can also make it hard to urinate and have sex. The pain may spread to the perineum, the area between the scrotum and anus, the lower back, the groin, or even the tip of the penis. Sexually transmitted infections, urinary tract infections, or even stones in the urinary tract can cause similar feelings, but they are less common. Men sometimes ignore the pain, thinking it's just a temporary irritation, but pain that lasts or comes back is a clear sign that something is wrong. Inflammation and infection can harm the prostate, make it harder to get pregnant, and make sex less enjoyable if they aren't treated. 3. Blood in the urine or semen, hematuria or hematospermia. Seeing blood in urine or semen is often one of the most frightening things a man can see. Blood in urine can make it look bright red or give it a pink or cola-like color. It can be bright red streaks or a rusty brown color in semen. In some cases, the blood is so small that routine tests can only find it with a microscope. A little bit of blood can be caused by temporary irritation, hard exercise, or a small injury to the urinary tract. However, bleeding that doesn't stop or comes back should be taken very seriously. In men older than 40, infections, stones in the kidneys or bladder, inflammation of the prostate, or cancers of the prostate, bladder or kidneys may be to blame. Bleeding can also happen after medical procedures like catheterization or prostate biopsy, but it usually goes away quickly in these cases. If you ignore blood in your urine or semen, the biggest risk is that it could be an early sign of prostate cancer, even before you feel any pain or notice any changes in how you urinate. Because the urinary and reproductive systems are so closely linked, finding the source of bleeding requires specific tests, such as urine tests, imaging scans, and sometimes cystoscopy. Getting medical help right away can help find and treat any serious condition in its earliest, most manageable stage. 4. Trouble starting or keeping urine flow going. If a man has to wait a few seconds for the urine to start flowing, if he has to push or strain to get it going, or if he notices that the stream is weaker or stops and starts in the middle of the flow, the most likely cause is that the prostate is too big and is blocking the urethra. This is a common sign of benign prostatic hyperplasia, BPH, which is very common in men over 50. It could also be due to scarring in the urethra from past injuries or infections. This is the problem's cause, which happens because the prostate squeezes the urethra. As it gets bigger, the passageway for pee gets smaller, which means the bladder muscles have to work harder to push pee out. This could also cause incomplete emptying, which is when a lot of pee stays in the bladder after each trip to the bathroom. If the backup pressure reaches the kidneys, this leftover pee can, over time, increase the risk of urinary tract infections, bladder stones, and even kidney damage. The presence of urine makes this risk higher. Men often unconsciously adjust to this change by giving themselves more time to use the bathroom, changing their posture, or avoiding long trips where they might not be able to find a bathroom. These changes might make things easier in the short term, but they are really just a way to hide a bigger problem. If the bladder isn't looked at, it could stretch too much and lose its ability to contract properly. This makes it more likely that surgery will be needed. Pain that won't go away in the lower back, hips, or pelvis. Pain in the lower back, hips, pelvis, or upper thighs that doesn't go away with rest, stretching, or over-the-counter medication can sometimes be a sign of serious prostate disease. Most musculoskeletal pain isn't caused by the prostate, but advanced prostate cancer often spreads to the bones of the pelvis and spine, causing a deep, dull ache that gets worse over time. Chronic prostatitis can also cause ongoing pelvic pain, which is often described as pressure or heaviness in the pelvic floor, and may spread to the lower back or groin. Prostate-related pain, on the other hand, can stay the same no matter what you do, and may come with other symptoms like changes in urination, trouble sitting comfortably, or pain during ejaculation. Muscle pain, on the other hand, usually gets better with movement and worse with strain. Many men have trouble telling the difference between normal back pain and pain that means something is wrong. Pain that gets worse over weeks or months happens with unexplained weight loss or fatigue, or comes with trouble urinating are all red flags. Finding prostate cancer early before it spreads is very important for effective treatment, because bone pain related to the disease often means it has reached an advanced stage. After age 40, paying more attention to your urine patterns, sexual function, and pelvic comfort is not only good for your health, but it can also help you find serious diseases earlier. There are 5 warning signs that should never be ignored: blood in urine or sperm, frequent urination at night, painful urination or ejaculation, problems with urine flow, and constant pain in the pelvis or back. Most of the causes are not dangerous and can be treated easily, but some are signs of a condition that could be deadly. An early medical evaluation, along with regular prostate exams, a healthy lifestyle, and an understanding of family history, remains the most effective approach for maintaining prostate health and preventing future complications. Gentlemen, if you'd like to take better care of your prostate health, I've created a free checklist with natural ways to support it. First link below. And if you want to see the supplement that's changing lives, check the second link. Thanks for watching. Don't forget to like and subscribe to our YouTube channel.